I'm AARP Senior Vice President Jean Setzfun, and I want to welcome you to this important discussion about the coronavirus. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. Today, we'll talk with experts about the disparate impact of the coronavirus with a focus on why multicultural communities are facing greater challenges. If you participated in one of our teletown halls, you know that this is very similar to a radio talk show, and you'll have the opportunity to ask questions live. If you would like to ask a question about the disparate impact of the coronavirus, please press *3 on your telephone to be connected with an AARP staff member who will note your name, your question, and place you in the queue to ask your question live. Again, if you'd like to ask a question, please press *3. Hello, if you're just joining us, I'm Jean Setzfun with AARP, and I want to welcome you to this important discussion about the impact of the global coronavirus pandemic. We're talking to leading experts and taking your questions live. Again, to ask your question, please press *3. Joining us today, we have three esteemed guests with us. We have Clarence E. Anthony, CEO and Executive Director from the National League of Cities. We're also joined by Oliver Tate Brooks, MD, President of the National Medical Association. And finally, we have Michelle Singletary, personal finance columnist from the Washington Post. We'll also be joined by my AARP colleague, Mike Watson. Mike will be our organizer and help facilitate our live calls today. AARP is convening this teletown hall to help you access information about the coronavirus. While we see an important role for AARP in providing information and advocacy related to the coronavirus, you should be aware that the best source of health and medical information can be found at the Centers for Disease Control and Prevention, the CDC. You can access their resources at cdc.gov/coronavirus. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after our event tonight. Today, we're talking to experts and taking your questions on the disparate impact of the global coronavirus pandemic. To ask your question, please remember to press *3. This is a trying time for many of us, and AARP is advocating tirelessly for our members and all people aged 50 and older during the pandemic. First, AARP fought to ensure that Americans whose primary source of income is Social Security will receive payments up to $1,200 under the recent economic stimulus package. They will not have to file additional paperwork in order to receive the payment. You can visit aarp.org/coronavirus to use AARP's stimulus payment calculator to estimate the value of your payment. We've also fought to push for expanded unemployment insurance as well as paid sick leave and family leave for people who need to take time off to take care of themselves or their loved ones. Here in Washington, D.C. and across the country, AARP representatives are fighting for you during this public health crisis on issues ranging from virtual visitation in nursing homes, telehealth, paid leave, and more. Let me just highlight a few examples for you. AARP state office in Arizona, Missouri, Texas, and West Virginia have fought to protect people from electric, gas, and water disconnections and late payment fees. At a time when it's more critical than ever to stay connected to your loved ones, many AARP state offices, including California, Connecticut, Tennessee, and North Carolina, are fighting to ensure that people can retain access to their telephone and broadband internet. In places like South Carolina, New Jersey, California, and Wisconsin, AARP is working to ensure that residents have access to information and needed health care. AARP's Illinois team has been named to Chicago Mayor's Task Force on Racial Inequality to stem the rise of deaths in that city. And in New York, Michigan, and Massachusetts, we're calling for more racial and ethnic data collection, outreach, and testing in communities of color, and seeking commitments from leaders to address the underlying issues of hunger, health access, transportation, and more. These are important issues that communities are facing, and AARP staff and volunteers are proud to be fighting on them. And speaking of volunteers, this week is also National Volunteer Week, so I want to recognize the incredible contributions of AARP members, volunteers, and older adults across the country who make their voices heard through phone calls, emails, and much, much more. Thank you so much for all your service. Now, let me formally welcome our distinguished guests. Again, first we have Clarence E. Anthony, who's the CEO and Executive Director of the National League of Cities, the voice of American cities, towns, and villages, representing more than 200 million people. Clarence began his career in public service as the mayor of South Bay, Florida, for 24 years. And under his leadership, NLC, the National League of Cities, has advanced policies that expand local control and provide direct funding for local programs related to public safety, infrastructure, transportation, and sustainability. Next, we have Dr. Oliver Tate Brooks, who's the president of the National Medical Association, the largest and oldest national organization representing African American physicians and their patients in the U.S. In addition, Dr. Brooks is the medical director and past chief of pediatric and adolescent medicine at Watts Healthcare Corporation in Los Angeles, California. He's also the medical director for LA Care Health Plan, one of the nation's largest Medicaid managed care plans. Finally, we have Michelle Singletary, who's the first personal finance columnist for the Washington Post, where she writes the nationally syndicated award-winning column, The Color of Money. She's written 3 personal finance books and was the personal finance expert for The Revolution, a daytime program on ABC. And for 2 years, Michelle was the host of her own national television program, Singletary Says, on TV One. Thank you all so much for joining us today. All right, let's get started with our discussion. As a quick reminder for our listeners, please ask your questions by pressing *3. Clarence, I'm going to turn to you first, and I'm going to jump right into it. So how are local governments responding to the pandemic? As they respond, how are they addressing this very troubling data and information we're hearing about African Americans and Hispanics being disproportionately affected by the coronavirus?
Yeah, Gene, thank you all for inviting the National League of Cities to be a part of this important conversation. And as we know, the local leaders, the mayors, the council members, are on the front line every day trying to continue to lead their communities through this unprecedented virus that we are experiencing. With over 800,000 cases and 45,000 deaths, local leaders have to step up and lead. You know, they are partnering with their healthcare providers. They are providing food to communities that don't have access to food. They're also working with their local businesses to be able to help them plan to get back to what we will never see as normal. But one of the things about this subject that we're going to talk about is that local leaders really recognize the disparity that we have in regards to this COVID-19. And we must ask ourselves the question, why is this data wasn't being collected before? And what does it really reveal? It reveals something that we've always known in America, and that is we knew that race was still a strong predictor of one's success in our country, from infant mortality to life expectancy. And what this virus has done, it's identified that we have systems failures as it relates to this crisis, and mayors, council members, and all local elected officials must demand at the state level, that as well as the federal, working with CDC, that we collect this data, not just to have the data, but how do we address the issues of the historical systems of loss that we've had in African American communities: health, income, wealth, access to government resources. So this is going to be a difficult challenge, but I can tell you that Mayor Lightfoot in Chicago recognizes that 32% of the population is African American and 72% have been tested to have the virus, and that is horrible. And we also know in Louisiana, Black people represent 32% of the state's population. However, they account for 59% of those cases that have been tested positive. So local leaders recognize this, but we need a federal partner. We need state data disaggregated in a way that we can now turn back and come up with solutions to deal with this historical issue that America has not addressed in the past.
Thank you for that. Thank you for that, Clarence. I think it is important first and foremost, as you say, to collect the information. And if anybody can do it, the local leaders can with their action bias. So thank you for that. I'd like to turn to Dr. Brooks. We just heard Clarence talk about the data showing that people of color are disproportionately affected by the coronavirus. He cited information specifically around Chicago, Louisiana. Why is this the case? And what can we do differently to address this problem?
All right, and good evening to all, and I appreciate AARP hosting this discussion on disparities and the impact of coronavirus. So I represent the African American physicians, which is what the NMA represents, but the NMA also represents the African American community, and this is a critical issue. Latinos also are found in these numbers. In terms of these disparities, my primary statements will relate to the African American community, but the Latino population is also suffering. So why is this happening? So again, national data showing 2 to 2.5 times the rate of hospitalizations and death. And he disaggregated, but I think it's also good to look at it on an aggregate level. So generally, overall, we're seeing 2 to 2.5 times the rate of hospitalizations and deaths by COVID from African Americans. So basically, the way I look at it, it is a toxic mixture of 3 primary things that we see. Okay, the minorities we have more of what I call comorbidities. We come into this sicker. Now, note these 3 things all intertwine, and there's a thread to go through all of them that connects them. So as it relates to that, we are seeing that COVID-19 has higher impact on those with diabetes, hypertension, obesity, lung disease. African Americans have twice the incidence of diabetes, 20% more hypertension, 30% more likely to be obese. So that's there. So that puts us right in the mix for having worse outcomes. Next is social determinants of health. Basically, those are economic stability, physical environment, education, food community or food security, social content, and healthcare system. So a few brief examples. We are more likely to live in housing where you cannot separate. If 6 people in a 2-bedroom house, that's going to be a problem. You have, and it'll be spoken on by Ms. Singletary, but our wealth is 1/10 that of the white population. So you have the social determinants of health, which is a significant issue. And then we tend to be uninsured, twice as likely to be uninsured. There is a study that shows, tell me your zip code, and I will tell you your life expectancy. So that's out there. And then the third mixture, comorbidities and social determinants of health, is implicit bias, so we just call it what it is. It's racism. There's been a history of racism in our country. And just to describe, I'm just going to give a story that was presented in the Detroit Free Press about a week ago. I think it was on the 19th on Sunday. A gentleman named Fowler, I think it was Gary Fowler, went to 3 different hospitals. He had symptoms: fever, shortness of breath, cough. Could not get tested, did not get admitted. Went home, died in his easy chair. Okay, the day after they took his body to the mortuary, his wife went to the hospital, and they would not test her. Someone came in, said, I ate some bad sushi and my stomach is upset. They took her back and treated her as if she had coronavirus. So there's a bias that we have to address that's going on in this country. And there are a number of things that we can do. And primarily, we need to be very scrupulous about prevention. Wash your hands, cover your cough. Have to advocate for ourselves. Okay, if your blood pressure is high, get it under control. If diabetes is out of control, take your medications. And we need to just have a clear understanding. We need better testing, which was mentioned. And there are lots of other things we can do. We can discuss those as we move forward.
Great. Thank you so much. Thank you for highlighting that so clearly in terms of the three factors. Michelle, let me turn to you. As much as we just talked about coronavirus being a health crisis, we know that this is quickly impacting our pocketbook too. How has the economic fallout of the pandemic affected different areas of the economy, and are people of color also being hit harder?
Well, thanks again for having me as well. I think this is a great forum and conversation so far. I think Dr. Brooks hit it on the nail. We were already behind, and I say we because I'm an African American. We're already behind in so many areas economically. And much of it, but not a fault of our own. The legacy of racism, we like to think that if we have overcome, and we have a lot of things, but there's still a lot of discrimination that has resulted in housing crisis for African Americans. We're underemployed. Our pay is still not equal. The net worth, and the net worth is tied to housing because we have homes, but in our neighborhoods, because they're redlined, they don't have the same value and appreciation. My home in a different neighborhood would probably be worth twice what it's worth in my own community. And then right now with the virus, many people can work from home except for African Americans because the type of jobs they have don't allow for that. And so, I mean, there's this old saying that when the country got a cold, we got a flu. Well, my goodness, we have already had a pandemic before there was an official pandemic. And that's really tragic because we will come out of this, but I'm afraid that African Americans will be further behind because this economic crisis is so deep.
Absolutely. I think, again, calling attention to this is one of the things that we want to do to raise the voice and also bring some more attention to it. So thank you so much, Michelle. Dr. Brooks, I think Michelle just mentioned this whole issue of people having to leave their homes, particularly people within the communities of color have to leave their house in order to work. And there's more. I think there are, as Michelle mentioned, people within the communities of color having to leave their house rather than teleworking. What advice do you have in preventative measures, especially if there's, again, multi-generational homes? If you have grandparents who are taking care of grandchildren or living in multi-generational homes, how can people stay safe even if they're leaving their house? What can they do?
Right. So I think that's a great question. It's a difficult question, and there's actually no clear guidance. So this is just an amalgam of information that I would have to think about to give an answer. So what I'd say, first of all, as best they could, if they came back home, they could self-isolate. And that's kind of impractical. I mean, you live there. The other people live there. So that would be ideal, be in another room altogether. But that's not going to happen. So what I would do is, first of all, that the person that needs to focus is the person going out. That's really important. So if you're going out, you would really be scrupulous about infection control. Wear a mask 100% of the time that you're around people. Wash your hands more often, for example, that when you're out. Keep that physical distance, that 6 foot, even with a mask. Okay, just remember, a mask protects other people from you, doesn't protect you from them. It's general masks that we wear. I would say if you can, cover your clothing, a jacket, a gown, something, so your clothing is protected. Now you've come out, you're coming back home. After you leave work, wash your hands when you get in the car or however you leave, because you want the connection from work over. That's what I would say. And then when you come home, take off that jacket or or whatever you have, leave it outside. Don't bring it in the house. And I would say at home, be very clear, wipe down those counters, cover your cough. And I'd also say for grandparents, grandchildren, people, just don't be as huggy and loving. Get some virtual hugs, just try to just practice what you feel is good hygiene. And one other thing I would ask is, and would suggest, is for children, clean their toys, clean their phones, clean their electronic devices. And then people should not share utensils or drink after each other. So those are just some of the questions, some of the ways that I would answer that question.
Really good practical advice. I think I've heard a lot of people talk about physical distance in addition to social distancing, and I think you're reminding us a lot of that as well. And since you mentioned the hand washing, I've also read or seen guidance around gloves. What do you think about that? Does that help at all in terms of wearing gloves, particularly at work?
So I have mixed feelings about gloves. I think gloves serve a purpose. For example, I use gloves when I go out and get gas because I can get the gas, I can whatever I have to do with my credit card, take the gloves off and throw them away. The problem with gloves, I think people get a false sense of security. So they have on gloves, they're at work, they're on the keyboard, they go somewhere to lunch and they're in the lunchroom, then they come back to have the gloves. Then they touch their face or something. You get this feeling that with gloves, your hands are pure or something. But remember, everything that a glove touches is the same as your hand touching it. And people don't tend to wash their gloves. So I would say that if you really are comfortable with knowing how to use gloves and understand that everything you touch is on that glove, then yes. But in general, I'm more in favor of frequent hand washing and then cleaning down surfaces.
Great. Very clear guidance. Thank you so much for that, Dr. Brooks. All right. Now, I think now it's time to take your questions. We have a lot of questions rolling in. So let me remind folks that if you want to ask a question, please press *3 to talk to Dr. Brooks, Clarence Anthony, and Michelle Singletary. Again, press *3 at any time on your telephone keypad to be connected with an AARP staff member who's going to take your question and put you in the queue. Let me now reintroduce my AARP colleague, Mike Watson, who's going to facilitate our calls. Welcome, Mike.
Thanks, Jean. I'm happy to be here for this important conversation.
Wonderful. All right, Mike, I think you've probably queued up a couple of calls for us. Who's online for us right now?
Yes, we have Sonia from New York.
Hello, Sonia. What's your question for us?
My question is that I'm a senior. I live in a small town in an independent living community, yet the town's supervisor, even though they sent out information, aren't really going around to the different places where senior lives because they don't have computers or cell phones. We are really not apt to find out what's going on and how it can be helped. The pantries are getting low, and not everybody has money to go to the supermarket.
Great. Thanks so much for your question, Sonia. I think this is a question I'm going to ask Clarence. There's different types of communities across the country, and it sounds like Sonia lives in a smaller, more rural community. Any thoughts on how leaders within smaller communities are addressing this issue?
Yeah, and Sonia, thank you for that call. And there, initially, the hot spots in America was considered the larger urban communities. But what we're seeing is that it is slower to reach rural communities, but the impact is growing faster and faster in those rural communities, especially in the senior population. And what we're seeing is unique because the challenge is like threefold. First, the lack of transportation options. They've closed down some of the transportation modes that would bring people into communities or get them around their community. And therefore, those that really need the access to health care, they can't get it. The second thing is that, seniors as well as vulnerable population and Black communities specifically, they talk about driving up, just common sense things. And local leaders are now raising their voice around trying to make sure these transportation modes are there. The access to health care is a big, big problem. And what is starting to happen there is that mayors and council members are using transportation modes or bringing access to those citizens by working with their county and state level to go to those facilities to get people out and to get them into a health system that would help them. And third, I think Sonia was right. Broadband, 100% is a problem for rural communities. Especially, again, African-American communities and poor, vulnerable communities. That is the last place in Washington, D.C., and Chicago and other large cities that they go into the Black community to have 5G and 4G. Rural communities are even further behind. And being a former mayor of a rural city, I can tell you that those healthcare factors and the life expectancy of people of color, as well as those that are in rural communities like that, is a lot lower than those that are in more dense communities. So there's a recognition by the local governments, and we're fighting hard to try to get money to those rural communities.
That's terrific. I know your organization's been fighting hard to give greater access to the smaller communities, so thank you for that advocacy.
Okay.
All right, Mike, who else do we have online? Who's our next caller?
Hi, Jean. Our next caller is going to be Pauline from Alabama.
Hello, Pauline. What's your question for us?
Good evening, and thank you for allowing me to participate. My question is, I have a friend that is 50-plus years old, retired, and she received Medicare benefits. And she filed for her stimulus package, and she said they told her that she doesn't qualify. She's also a caregiver for her mom, and a lot of her money, her mother doesn't have much finances coming in, so she used mostly her mother money for her mother. So what does she do?
Question, Pauline. Regarding the economic stimulus, Michelle, can I ask for your help on that question?
Yeah, I'm not sure why I think she might be getting some misinformation because the stimulus package is based on your adjusted gross income. So unless this caregiver as an individual is making more than or adjusted gross income of more than $75,000, she absolutely does qualify for the stimulus money of $1,200. I think there's been some confusion about how you collect it, so maybe that's what it is. And so she wouldn't be on Social Security. So if you don't file a tax return or you're not required because you don't make enough, you do have to use a tool on irs.gov to put in your information so they know that you're there, so that you can get your payment. Otherwise, if you filed a 2018 or 2019 return and you meet those income levels, it's $75,000 or less for an individual and double that for couples, she would get the money. So I think there's probably been some misinformation. I'm pretty sure that her friend does qualify for the stimulus money.
That's really helpful. And then you also mentioned going to irs.gov. Is there a particular place on irs.gov Pauline should check out?
Yeah, when you go to the home page, and be very careful when you type it in because they don't want you sending you to some wrong site. So it's irs.gov. On the home page, it'll say non-filer if you don't normally file a tax return. If you file a return and you want your money direct deposited, you would use the Get My Payment tool. But again, if for example, maybe she's not tech savvy, as long as you have a return from the IRS for either those 2 years, 2018 and 2019, you will get your money, but it'll be sent through a check.
Great. Thank you for that. Very clear. Appreciate that, Michelle. All right, Mike, who else do we have on the phone tonight?
Hi, Jean. Our next caller is going to be Beatrice from Missouri.
Beatrice, hi. What's your question for us?
Good evening. My question is this. Per the media, African Americans comprise the largest percentage of deaths in the U.S. from the COVID-19 virus. Taking under consideration the population, the percentage of population in the United States by Caucasian Americans and African Americans, am I to believe that more African Americans with underlying chronic health conditions exist in the United States than whites?
Thank you for that question, Beatrice. Dr. Brooks, I think you covered this before in terms of the statistics and the underlying sort of health profile across the U.S. Can you refresh our memories with that again to address Beatrice's question?
So certainly, and thank you, Beatrice, for asking the question. In percentage, yes, we have African Americans have higher rates of hypertension, which is the number one link to having an adverse outcome. 20% more diabetes, 2.2 times as common among African Americans as the white population. Obesity, 30% as common. But I want to just emphasize one other thing too, Beatrice. The studies are also showing that if you get your conditions under control, you're less likely to have a problem with it. So again, I just want to emphasize. So the answer to your question, yes, it's just in raw numbers, but there may not be more deaths, but as relates to percentages, much higher level among the African American population, because yes, we just have those conditions for the reasons that I delineated, and I appreciate the Surgeon General putting a spotlight on this issue with disparities.
And just a quick follow-up.
Jean, can I add to that, if you don't mind?
Absolutely. Absolutely.
Yeah, I was also going to add to that also comes with some systemic practices that America has had. The siting of oil refineries, waste facilities, some of that has caused us to have some of the breathing problems that we've had in America because of that. The diabetes, we have food deserts in the African American community where we don't have the quality vegetables. We have the markets and the stores there that sells poor quality food. And so you go where it is in your neighborhood. And thirdly, it gets back to healthcare and access to healthcare. Being able to access that healthcare in a timely manner is very difficult, and the cost associated. So, yeah, it is true, but some of that has been systemic practices of America, and I think that, Michelle talked about that a little bit in terms of redlining and housing. So, some of this is historical in our system.
Great. So the pandemic is also sort of raising some underlying systemic issues within our communities that we have to resolve. And going back to Dr. Brooks and his point around getting the health conditions under control, given the circumstance right now with either doctors and hospitals filled with more cases and likely more instances of contamination, any guidance on our listeners tonight in terms of what to do, leveraging potentially telehealth, or how any guidance on that in terms of seeking safe routes to get access to healthcare right now? Right.
That's an excellent question, and we're dealing with that on a daily basis. So you mentioned telehealth. Telehealth is very, very important at this point in time. And a lot of information that you may need in terms of your health, you can get through a telehealth communication. And you even look at blood pressure. So, for example, in LA, automated blood pressure cuffs are covered by Medicaid. So theoretically, let's say it's not covered. Go spend the $30 it costs to go buy one, and then measure your own blood pressure. A lot of people that have diabetes, they measure their blood glucose level. So you can do a lot to help yourself. Right now, a lot of places are not having non-essential visits. So that you bring up a very good point regarding that. So you don't have to be in the doctor's office to get yourself healthy.
Great. Thank you for that guidance. All right, let's turn back to the phone lines. Mike, who do we have on the phone?
Hi, Jean. Our next caller is going to be Pam from New York.
Hello, Pam. What's your question for us?
Hi. My question is about the Family Leave Act. I have it through my work, for my mom for on days that she's not doing well. She's 79 years old. And I had put in my days here from March 13th on, but they're telling me that the state or whoever hasn't approved that family leave can pay people for taking care of their parents and not working through this coronavirus.
Right. Well, thank you for that question, and thank you for taking care of your mom. That's most important. Michelle, can I turn to you for that question? Any guidance on the Family Leave Act?
Well, I'm wondering if she means the provision under the CARE Act where if you are unemployed, there's extended benefits even if your hours are reduced. But I'm not sure why she would not be approved under the Family Leave Act. Dr. Brooks or Anthony, would you know more about that? I'm afraid I don't have the answer for her.
I really cannot shine any light on that. I'm sorry.
No, that's quite all right. Great. Well, thank you for that. And I think, Michelle, I think you're getting good guidance to check two places, right? I think both employer and if there's some access to the expanded unemployment benefits, I think that's also another place to look.
Yeah, right. I think you would be checking with your employer for the approved leave, and then if she was trying to access the unemployment part of the CARES Act, where they extended it for people who had to leave their job to take care of someone as a part of this pandemic, then they were supposed to get extended benefits. Now, in many states, that's not happening because the systems are just overwhelmed and they can't get to people.
Right. So that's also another good reminder to be persistent as well. So thank you for that. All right, Mike, let's go back to the phone lines. Who's our next caller?
Hi, Jean. Our next question is actually going to be from YouTube. Ramel from YouTube asks, what do you know if you know a person who has been walking around exposed to COVID-19, possibly infecting other people and refusing to get tested?
All right. That's a somewhat of a troubling question. Let me start with Dr. Brooks. So if you know somebody who's probably knows that somebody else has been exposed to COVID-19 and maybe asymptomatic or symptomatic walking around but refuses to get testing, what's your guidance on that front?
That's a good question. That's an interesting question. So what I would recommend, and that bothers me because theoretically, for example, if someone has tuberculosis, we can quarantine them, we can isolate them. The Department of Public Health has that authority. What I would do is I would call your local or county public health department and report. Again, it's interesting. It's like being a private investigator. I would get as much information as I could, specifically the person's name and date of birth, if you could, and then I would report them. I would say, this is what I am observing, because you can, as an individual, act on that. But there may be provisions under your state or local authority that would allow them to, investigate this person. That's what I would recommend.
Can I add one quick thing? This is Michelle.
Sure.
I think we all need to be very careful. I mean, I think Dr. Brooks is right, but I think we need to be careful because we're all very paranoid right now, and many of us think we have it and we're not sure. And quite frankly, despite what the administration is saying, not everybody can get a test who wants a test. So we're not even sure this person is not getting it because they just can't. My daughter has asthma, and she had a cold when she came home from college, so obviously we were very concerned. And when she called and the doctor asked her a litany of tests, and they were like, well, no, you can't get a test. Just wait and see what happens. As it turns out, it was just a cold. She didn't get any high fevers. So, and then there are people who want to know if someone in their building has it. Should the apartment complex inform the other residents? There are privacy laws. There are HIPAA. Of course, Dr. Brooks would know much more about this. But we can't go around, making people tell us what they have and if they have it or not. I think as an individual, we need to make sure we take the precautions that Dr. Brooks mentioned so that we don't catch it. But we don't want to get into a state where, somebody I mean, I was on I don't know where I was on a plane or somebody coughed and everybody sort of just stopped and like panicked, I mean, it was like, oh, they coughed. And I have allergies. My husband's got allergies. And I find myself saying, no, he has allergies. So just, let's just take a pause and recognize that people have medical privacy as well. You can't make someone take a test, but you certainly should practice and encourage people, but recognize that even if someone thinks they have it, they may not necessarily be able to be tested right now.
That's a really good point. And I'm actually going to go back to Dr. Brooks on that, too.
Right.
What guidance do you have for us right now? Because there may be some limitations on still testing facilities and getting access to a test.
So, two things. First, I do appreciate Ms. Singletary's statement. My presumption from the question was this person was overtly spreading, going around coughing with no mask or something like that. And I guess from my perspective, at least in California, you have to wear a mask just to even go out. So that was my mindset, that theoretically you're seeing someone walking around that by law is to be masked, and they're not masked. So I do therefore appreciate Michelle's comments. So testing is real tricky. It varies from locale to locale. Some places are testing everyone. Some places are limiting it to if you have this particular symptoms. So, and what she stated also is true. You may want to get tested and can't get tested because you didn't pass the screening criteria. So what's going to happen over the next weeks and months is there's going to be more and more testing. So there's no clear answer to your question because it's very variable. I would submit that if you are symptomatic, and right now primarily we're talking about fever, cough, shortness of breath, flu-like symptoms. Some places GI symptoms are also part of it. If you screen positive, you should be getting tested. But again, the testing criteria are being more and more relaxed. Some areas, if you're a healthcare worker, you can get tested. Some areas, if you're 60 or 65 and older, you can get tested without any other criteria. So I would say that look to your local area to see exactly how testing is going. And again, I'd say look to your local health department, or not your state health department.
Great, thank you for that. That's very helpful. Let me remind folks that if you do have a question, to please, again, press *3 to be able to access one of our staff members to get your question in the queue. Before we go back to your questions, just wanted to highlight a service that AARP has. Sometimes hearing a friendly voice can help during this challenging time. AARP Community Connections is a toll-free service for adults 18 and older. We have trained volunteers standing by to provide a friendly call or just to say hello. If you'd like to speak to someone Monday through Friday, 9 to 5 Eastern Time, please call 888-281-0145. You'll leave your information with us, and a volunteer will call you back. And if you prefer, we can set up a recurring call, for example, Wednesdays at 2 o'clock, just for a quick check-in. Again, this is a free service for all adults, regardless of membership. We do have some bilingual capabilities as well, including Spanish. And that number, again, is 888-281-0145. All right, let's turn back to our experts and learn some more from them. I'm going to turn to Clarence. We talked a little bit about this already in terms of, quote-unquote, hotspots that are most affected by the coronavirus. We're seeing that mostly in the densely populated parts of the country. We talked a little bit about this with the previous caller, too, but because we see that smaller communities and rural areas are feeling the effects as well. How are different types of communities feeling the impact? How have they responded? Clarence, you told us a little bit about this before. Tell us a little bit more about what National League of Cities is doing on this front.
Yeah, that's a good question. Again, I talked a little bit about the perspective on the news. You see so many large cities in the news and getting resources from the federal government directly. And in the past 3 bills, especially the CARES Act, if you were a city with a population of 500,000 or higher, you got direct funding from the local government, from the federal government. And if you were not, you had to basically go and beg the federal government or the state government for money. And that's disappointing in that a lot of the impact, again, it's moving slowly, but it's going into these rural communities, the Oklahomas, the Mississippi, the Alabamas. You're seeing it tick up in North Carolina and South Carolina. And what we're doing is helping those elected officials to be able to advocate to try to get money directly from the federal government, one, but secondly, advocating to get testing for their citizens and residents in those communities. We also saw where some communities, Albany, Georgia, for example, has one of the highest per capita of their population tested high for COVID-19. And it was because some of the practices were still occurring in some of these rural communities. They were still having church services, funeral services. And so we are advocating and pushing and giving tools to our leaders to help them to first educate and get services to those communities. And if we don't focus on that population and get the resources down, America really is going to have a hard time rebounding economically. And so we're focused on that as we are focused on the larger communities.
Absolutely. I think there's a real tension there. And as I think we're hearing more and more in the news about restarting again in some communities, I'm sure that's a really hard decision to make. Anything that you're hearing across the country from your members about that topic of, again, restarting in certain communities?
Yeah, we are in constant contact, our mayors and council members, with the federal government and the state government. And our leaders are very concerned. They're very concerned that we are in a rush to open back up for business when we're not prepared. We're concerned that we may see, and Dr. Brooks may know better on this, we may see another bump, a major bump in the fall if we go back too quickly. So what local leaders are hoping is that we can get our governors to understand that we should not sacrifice the lives of people just to open back up. The governor in Georgia is an example. Our leaders in Georgia feels that he's irresponsible, insensitive, and only focused on trying to open up businesses so that the economy would bounce back for political reasons. And he's talking about opening up beauty parlors and barber shops and places like that, massage parlors. And one great leader, I will tell you, Mayor Keisha Lance Bottoms, who family was in the beauty supply business, said that she was not going to act by allowing those facilities to open back up. But what she also did, she made a step forward. She created a fund for the beauty supply industry so that she can get monies to them so that if they don't open, they will have money to help them with their bills. That's what local leadership is all about. We don't need to open up at this point. We don't need to rush, because if we do, we will see thousands and thousands more lives taken in our communities, especially the African American community.
Thank you for that. Thank you so much for that, Clarence. What a great example there. And speaking of sort of economics, Michelle, let me turn to sort of this whole issue of personal finance. What advice do you have for people who are in an economic crisis right now? They're probably thinking about their immediate balance sheet versus sort of that longer-term impact and those decisions and the tension between those two. What tips and pointers do you have for them?
So I like to talk about it, and Dr. Brooks, forgive me if I don't use this the right way, but I try to encourage people to triage their bills like an emergency room would triage patients. So if you've ever had to go to an emergency room and it's full of people and not enough staff. They take the most critical patients first, and that's fair. That makes sense. So you need to do the same thing with your bills. Pay the critical bills first. Those are your necessities, the roof over your head, food on the table, if you need to go out to work, transportation, and let everything else go that you can let go. Right now, if you are laid off or furloughed or your income has been disrupted or maybe your spouse's income has been disrupted, your credit card bill is not a priority. You call the lenders and say, I cannot pay this. Please give me a forbearance. And many of them, almost everybody is right now. And take that forbearance. Don't worry about your credit score right now. That's something that you can worry about down the road because you need to take care of yourself just like those doctors take care of the most critical patients first. Yeah, your hand has been bruised. Maybe you dropped a hammer on it or something, and it may be, it's a sprain, but that person has a heart attack has to go first. So your mortgage, your rent, food, insurance that you need to keep that car going in case you get an accident. Those what you prioritize. And I know that, lots of people want to be financially responsible. They want to pay all your bills. But this is a critical time, when we have an extraordinary economic issue going on right now, and it requires extraordinary measures. Now, if you are working and your income hasn't been disrupted and you never built that emergency fund, now is the time to do that. It's just like Dr. Brooks talked about, taking care of yourself. So you were like living high, living above your means, taking them cruises and them vacations and stuff. And now that you're stuck in the house, use all that money that you would have spent going out and doing all the stuff that you shouldn't do. Build up that emergency fund because your job is not guaranteed either. I don't care if you work for the federal government, state government, or, me at the post. I'm not counting on my job to be there. This is a crazy economy we have now because of the pandemic. So save that money. Cash is king right now. So even if you're on an aggressive debt payment plan, if you have a job that you're not sure is very secure, you want to build up your emergency fund. Now, listen, if you're home and your finances are pretty tight, you're good, you're always a frugal, and you have extra, this is the time to let go some of that money and help other folks, be it in your family, your church community. You know who needs help, who's lost their job. Send them some money through PayPal or Cash Apps so they can buy some groceries, because we are our sisters and our brothers' keepers right now. And so those are sort of the three categories of people I talk about. We are all in this together. And so depending on where you are on that, I need you to do those things to make sure that you are, financially secure.
Thank you so much for that. Really clear guidance, Michelle, helping yourself and helping others. That's terrific. All right, before we turn back to your questions, I do want to provide a quick AARP Fraud Watch Network coronavirus alert. Scammers are unfortunately trying to get your money and your personal information by pitching fake cures, offering bogus investments, impersonating medical professionals to collect payments, posing as global health authorities to conduct email campaigns designed to load malicious software on your device, steal passwords, and other credentials. Google recently reported that they filtered more than 18 million phishing and malware emails every day from their email service. And yesterday, the Justice Department said that U.S. law enforcement agencies and website operators have taken down hundreds of fraudulent websites, including some that spoof government programs and entities. So if you can spot a scam, which we just told you a lot about, you can stop a scam. So go to aarp.org/fraudwatchnetwork to learn how you can spot and avoid COVID-19 and other scams. You can also report scams or get help if you feel like you've been victimized at AARP's Fraud Watch Network helpline, and that number is 877-908-3360. Again, that number is 877-908-3360. Wonderful. We're going to turn back to your questions again. Time to address your questions with Dr. Brooks of the National Medical Association, Clarence Anthony of the National League of Cities, and Michelle Singletary from the Washington Post. And let me remind listeners that if you have a question, please remember to press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question. And again, for more information or access to this recording and other resources and other events that we've had, please go to aarp.org/coronavirus. All right, let's take more questions. Mike, who do we have on the line?
Hi, Jean. Our next question is going to come from Marcus in Rhode Island.
Great, Marcus, your question for us.
Hello. Thank you to all the speakers for your comments and work on disparities. I want to frame my question. I'm thinking about the Spanish flu pandemic, 1918 to the 20s, and the impact, overwhelming impact that it had in Africa and the African American community here in the United States. I want to be able to, in my advocacy, I want to be able to point to some of that historical data on how that impacted those communities economically over the long term. Do you have any suggestions for or information about that historical data or any contemporary data that I can point to in my discussions?
Thank you for that good question, Marcus. Let me begin with Dr. Brooks. So hearkening back to the Spanish flu, what can we learn from that?
Well, he's speaking of the African American communities in the African continent. And I can't speak to that directly as an economic issue, but I can speak to it from an infection control, that when there was contact tracing, when people followed who had the flu and isolated those people that they were exposed to, we found that that was what stopped or at least diminished the death rate from the Spanish flu. As it relates to how that affected the continent and then African Americans economically, I just don't have any particular data. But infection control, what we're doing now is learned from what they did then.
Great, thank you for that. All right, Mike, who else do we have on the line? Who's our next caller?
Hi, Jean. Our next caller is going to be Ursula from Michigan.
Hello, Ursula. What's your question for us?
My question is, I'm calling for my daughter. She's self-employed. She's a beautician. She's got her own little store. And she is without work since March 24th. And the question is, she tried to get unemployment benefits and was turned down. And the question now is she getting any stimulus from the government or not?
Great. Thank you so much for that question. Michelle, I'm going to turn to you for that question. Again, I think there's a question related to access to the stimulus or potentially unemployment for somebody who's self-employed.
So I would encourage her daughter to appeal the decision, the claim, because a lot of the states, because their systems are crowded and there's lots of people, have made mistakes in denying people. So there's an appeals process. Every state has one. Obviously, everything is overwhelmed right now, but she might as well go through that because there could be a mistake along the way. And also, with the CARES Act, the states were allowed to add non-traditional people to the unemployment insurance rolls. So it could be that the state has decided that in her area they aren't going to give that payment, but I would definitely file an appeal. And secondly, if she is an individual and she is not claimed on someone else's tax return, doesn't sound like it is if she's running her own business, and as an individual she made $75,000 or less, she is definitely eligible for the stimulus money. And that would be $1,200. If she has children under 17, she would be eligible for an additional $500 per eligible child. So, but she had to file a return in either 2018 or 2019. If she has not filed a return, and I'm not saying her daughter, but some people, who work for themselves may not necessarily been following the tax laws like they were supposed to. But she can go into the non-filer tool to put in information so that she can get a check. Right now, they're not trying to chase anybody down who has, taxes. And the other thing is they're not going to snatch the money if you owe back taxes. The only reason why they will take the check is if you have back child support. So I would encourage encouraging those who filing an appeals claim for the unemployment, and she would definitely be eligible if she hasn't filed a return. Use the non-filer tool. If she did, and maybe they don't have a direct deposit information because she didn't get a refund, she should use the Get My Payment tool. And if I could just add, on the Washington Post website, we have Your Money in the Pandemic kind of page, which has a lot of FAQs, frequently asked questions, that involve the small business loan, the stimulus payments, unemployment. Every week or so, we're adding new FAQs to that, so that a lot of questions that people can't get through on this program, they'll be able to find answers to that on this landing page at WashingtonPost.com.
Great. Thank you so much for that, Michelle. I think potentially good news for our caller. Not only is it an or situation between unemployment and the stimulus, but it could be an and situation. So checking out both resources will be helpful. Thank you for that. All right, Mike, who's our next caller?
Hi, Jean. Our next caller is going to be Terry from South Carolina.
Hello, Terry. What's your question for us?
Yes. Thanks for taking my call. What is neighborhood redlining, and who is designing this?
Great question, Terry. I think we mentioned this on the call earlier. Clarence, why don't you take us through that again, the whole issue of unfortunate redlining?
Yes, the history of city planning brought this to head in a way where cities were designing parts of communities, whether it was housing and businesses, and what they did was they oftentimes created certain areas or developed certain areas that they designed housing and other programs in those communities, and those communities were sometimes the less desirable communities, and they put a population of folks in those communities. The first practice of redlining really occurred through the GI Bill when the federal government and all of the soldiers came back, and the vets got all of these loans. And first they weren't giving loans to African Americans. And then they started providing those loans, and African Americans started living and moving into those communities along with whites. And then the whites started moving out because they did not want to stay in those communities. And therefore, less investment occurred in those communities, and more attention then moved to where what we referred to in urban planning was white flight into those communities away from those African American residents. But what was lost was the supermarkets, the car dealerships, the movie theaters. But what was placed there could have been, landfills, oil refineries, and facilities like that. So the history of redlining is really creating a space in cities and in areas that you located low-income people mostly. And it's been a practice that the National League of Cities has been highlighting because it is systemic, it's racist, and it has caused a lot of communities to be economically challenged. And I think it's already been said by Ms. Singletary, Michelle, that, housing and the investment in the house is probably, your strongest investment that you will make. And the redlining has caused that not to be a place where Black families can see their economics grow.
Thank you for that background and context. And again, I think the pandemic is also shining a light on how devastating those systematic inequities are, also heightening the plight of particularly communities of color. So thank you for giving us that background and context. Mike, let's turn to some more calls on the phone. Who's our next caller?
Hi, Gene. Our next caller is going to be Paul from Silver City.
Hello, Paul. What's your question for us?
Well, my question is, being both a physician and also a Zen priest, I'm very interested in the emotional well-being of people. I mean, I hear people talking about the physical problems and so forth, but what organizations are out there? What people are practicing pro bono to sit and listen? And do we know who these organizations are and what's available? Because it's a tremendous amount of suffering that goes on, and the sale of guns is going up. I mean, I take a look at this and I say it's very serious. So that's my question.
Thank you so much, Paul, for highlighting the mental well-being also. Dr. Brooks, let me begin with you. Any thoughts on Paul's question there?
I think that it is excellent that he brought it up, because we are affected by this on a mental, psychological, if you will, spiritual way. So we do need to find some solace, if you will, in our lives. So in terms of specific resources, again, your local or county or state mental health department will have resources. So you can go there. Like, so for example, I know another thing that he didn't mention is there is the concern about domestic violence in terms of someone really can't get out of the house. So there are resources in that area. I think that it's important that he shined a light on this. That's why I use the term physical distance instead of social distance, because you need to keep your physical distance, but you don't be socially distant. Call your friends. Call people you haven't talked to in a long time. If you obviously there's no church, so there are virtual services for those who have that in terms of their faith based practices. He's Zen, so go inside yourself, meditate. That calms you down. I think it is important to note, and I did, that stress weakens the immune system. So if you are stressed because of this, you have a bit of emotional instability that actually is harmful to you physically. Specific resources I cannot speak to, but I am sure they are there, and it's something that perhaps the AARP can look at in terms of after this call, some specific information on where to reach for something to which he refers.
Great. Thanks so much, Dr. Brooks. And although we don't have medical staff on line, I did mention earlier that AARP does have a service called AARP Community Connections. And again, it's a toll-free service for all adults 18 and over. We have trained volunteers standing by to prevent friendly calls and just to say hello. To the point that Dr. Brooks just mentioned around physical distance versus social distance, here's a way to actually have somebody to have a friendly, informal chat with. So if anybody wants to take advantage of the service, we're available to take your call Monday through Friday, 9 to 5 Eastern Time. The number to call is 888-281-0145. Leave your information with us, and a volunteer will call you back. That number, again, is 888-281-0145. All right, let's move on to our next question. Mike, who's our next question?
Hi, Gene. Our next question is actually coming from YouTube. So this is Catherine from YouTube, and she said, I'm worried about losing my job and my health insurance benefits. I need coverage. What is available if I lose my benefits, and is anyone working to address this?
Great question from Catherine. Michelle, can you help us with this? Even though it's about health insurance, I think this person's concerned about, again, the high numbers of unemployment we're hearing about and possibly losing their employer coverage, employer-based health coverage. What can Catherine do about that?
So there are a couple of areas. So often when you lose your job-based health insurance, you can get COBRA, which is an extension of that employer health insurance. Now, the downside is it can be very expensive because you have to pay your share plus the share that your employer paid. So for a family of 5, that can be, a couple, up to $2,000 a month. So who can afford that, right? So, but it's an option to keep your coverage until you can get another job. There's also, if you lose your money and lose your job and qualify at some point, you could apply for Medicaid, which is the health insurance, the federal and state health insurance for low-income folks. And then finally, there's the health exchange. We commonly refer to it as Obamacare. So if you have a disruption in your income, low income, you may qualify for subsidies through the health exchange. And so you would definitely want to look into that as well. And on the health exchange, there are going to be different types of policies. So if you don't have a lot of money, you might just get a basic policy until you can get another job. But this question sort of goes to this whole larger issue of our health insurance being connected to our job. And I hope, and I'm a woman of faith, so I'm just going to say, and I pray that this coronavirus has exposed the problems with our economy, our health insurance, our job security, and that finally we get to the point where we realize we cannot have a population where our jobs is connected to our health insurance, which is why African Americans are so disadvantaged in here, because the jobs that they often have don't have health insurance or don't have good health insurance. And so, but there are avenues. There's COBRA, there's Medicaid, and then there's health exchange. And that means you're going to have to do a lot of homework, but it's worth it so that you can be sure that you continue the coverage for your family.
Thanks so much for that,
add
Michelle.
one thing in there.
Please, Dr. Brooks.
Mm-hmm. So also there's a network of community health centers called Federally Qualified Health Centers, FQHCs. And you can get care if you are uninsured at a federally qualified health center. Generally, there will be a copay. The copay is based on income, but you can also get care in that fashion if you're uninsured.
Thank you for that resource, too. Federally qualified, what was the A? What does the A stand for? I'm sorry?
FQHC, Federally Qualified Health Center.
Health Centers, FQHC, Federally Qualified Health Centers. Thank you so much for that. And while we were talking about that, one of my colleagues sent over some information from the last caller related to mental health supports. For those who are interested in getting some support from the National Mental Health Hotline, that number is 800-662-4357. Again, that number is 800-662-4357 for the National Mental Health Hotline. All right, let's turn
real
to...
quickly, Jean, also.
Yes.
If you go to CDC and you click on stress and coping, there are numbers there, National Disaster Distress Hotline and National Domestic Violence Hotline. So CDC is a source of information.
That's terrific. That's another great resource to access, the CDC for stress and coping. Thank you so much for that. All right, Mike, who's on the line for our next call?
Jean, our next call is going to be from Philippe.
Philippe, hello. What's your question?
Hi, my name is Philippe, and I'm calling in from Minnesota. I am a local elected official in Minneapolis, and I represent an area that is predominantly people of color, with a majority of our folks being Black. And what we've realized is that folks really aren't taking the guidance seriously around physical distancing, around wearing face masks. And so I was just curious if you all had any advice on how to be able to best communicate with communities of color on how to be able to stay healthy and take this seriously.
Good question, Philippe. Being a local elected official, let me begin with Clarence to see if he has any guidance from other members, and then we'll also ask some of our other panelists as well. Clarence?
Yes, Councilman, thank you very much and appreciate you calling in. That is an important element that we need to address. and that's making sure that accurate information is being provided to the African American community in Minneapolis and every community, because there has been information that has been shared that is not accurate around that this will not impact African Americans, and we've seen that is not a fact. A couple of things. First, local government is the most trusted level of government, and you have to use that to communicate and to make sure that information is sent directly to the African American community. And then I think you have to look at those important figures in the Black community in Minneapolis, whether it's the ministers, whether it's teachers, whether it's doctors or any other health care providers, and using social media in a way to reach those communities. I also got to tell you that we've talked about and know that a lot of African Americans may be getting this because they are in the service industry type jobs, whether it is still working at Home Depot, Walmart, or other stores, whether still working at restaurants where they're saying you can take out, whether it's drivers on mobility, the Ubers, the Lyfts. So some of this is because we're most often required, even though we don't want to, go to some of these jobs because it's maybe the only job that they have. So I think gathering on a virtual call with some of those leaders, using your role as a council member to bring people together and to use some communication strategies to get the word out in simple terms that shows the increase in the African American community, and that if you don't take this seriously, you know, not only will lose your life, but you can lose your entire family life.
Thank you so much for that.
Can I add one quick thing? Because I actually think that's such a great question, because, you know, it's a culture. I love what I think Dr. Brooks said at the beginning. Like, you know, I'm a hugger by nature, and I belong to a huge church, and we just hug every time we have stop for prayer. We're hugging. And when this first started, you know, I was like, okay, I just want to do elbow, and it was hard to get our folks to not do that because it's just who we are, you know. My pastor finally said, okay, listen, we got to practice these things. So I think that it's very important, especially for communities of color, that, you know, where there's lots of religious, you know, organizations and churches, to team up with pastors and leaders in the church to get the message to their folks. Because let's be honest, a lot of our communities don't trust the government for legitimate reasons. And so if you want to get the message to the people, you have to go through folks that they trust. And I mean, like our doctors, our lawyers, our religious leaders, our pastors, you have to team up with them and give them the right information that they can give it to the folks. Because I personally think that it wasn't until my pastor said, all right, y'all, stop hugging, that people stopped hugging.
Great. Thanks so much for that, Michelle. And I think hearing from a lot of local leaders and multiple points, sort of consistent messages is important. So I think definitely in terms of what we see in terms of surveys, local leaders by far are probably the most trusted amongst electeds. So I wanted to second that with Clarence. Did I hear another voice who wanted to add some more guidance on this point?
Yeah, this was Dr. Brooks. I just have to, because again, that is such a key issue. In the beginning, there were rumors that African Americans couldn't get COVID because of melanin or whatever the rumor was. That was one of the rumors. I was just on a call of experts, African American experts last night, and one of them said they had a flyer that was given to them that said COVID-19 is a hoax. Don't get the vaccine. So there's also it's out there that their message is anti self-preservation. So I think that what was stated, that the message has to come from African Americans to African Americans in a culturally appropriate fashion, that this thing is real. And to me, it's even doubly real because we're dying. Not only is it real, but we're dying at higher rates. So the messaging has to be there. I believe strongly in it, coming from the faith-based organizations, but also from Black physicians. So hence, the NMA stands strongly in support of getting the message out.
Thank you for that. Thank you all for that sort of a clear guidance that's culturally based from multiple leaders, consistent messages out there. Thank you so much. All right, we're getting close to the end, but let's try to get some more calls on the line. Mike, who else do we have on the call?
Hi, Jean. Our next question is actually Michelle from Facebook, who asked, how do we address access to food for seniors who are living in community food deserts?
Great question. Clarence, I'm going to turn to you. You mentioned this a few times. How can we help this viewer from Facebook access food in a food desert?
Yeah, I do think that's a really good question, and it's been difficult for local elected officials to be able to pull those resources together. But one of the things that we're seeing is even when it relates to kids, local leaders are providing 3 meals a day, having people, again, this is transportation challenge, but having a facility there where you can come by and to be able to pick up the food. Local leaders are working with churches to be able to deliver food to seniors during this time. And you're also finding a number of the fraternities and sororities and African-American communities joining with mayors and council members to be able to help get, the food and resources that is needed for the seniors in their communities. And I can tell you another piece about this. I am probably on the phone, especially now with all of these virtual calls, talking to leaders. And one of the things I need to say that came to mind while you guys were talking about who sends the message. I got to tell you, mayors, council member, elected officials are human. And we're also seeing them take risk. We're seeing them losing sleep at night because of what is going on in their communities. And the senior population is one of those challenging areas that they are working hard to be able to provide the service. So I'm hopeful that you will reach out to your local leaders, the trusted level, and say, if you're not getting it, what can you do for me to get this service to seniors?
Thank you for that. Thank you for that guidance and also a reassuring message that local leaders are working on behalf of vulnerable populations and the older population as well. We are coming to the end of our event, and I'd love to kind of close out with some final thoughts from our distinguished panelists. Let me begin with Michelle. Michelle, any final thoughts and recommendations for our listeners tonight, our AARP members? What should they understand most from the conversation today?
So I think we've been talking about a lot of the issues and problems, but I actually like to lay on hope, right? I truly believe that this too shall pass. That we, if you are suffering from this, you've lost your job, or maybe your caretaker is having some issues, that you try to get the help that you need, and recognize that there are a lot of us out there trying to help you. Most importantly, make sure you go to really good sources to get your information. Don't listen to someone who calls you on the phone or that text message chain. Go to AARP, go to WashingtonPost.com. We are working 14-hour days, and I'm not kidding you, to try to get you the right information to help you. And there's a lot of stuff going on. There's a lot of stuff not working, but there's lots of people out here, doctors and lawyers and the politicians, most of them, who are really trying to help you. Be patient, but know that at the end, this will end someday. And when it does, and even if you have some, financial, maybe you do lose your home. Maybe you got to move in with someone. At the end of that, there are those of us who are willing and able to help you reestablish yourself financially. We got through the housing crisis. And if you're African American, you know we got through some stuff, way back from slavery. We will get through this, but you have to be smart about it and reach out and get the help that you need.
Thank you so much, Michelle. Dr. Brooks, any final thoughts for our listeners tonight?
First, I would co-sign everything that Michelle just said, and she laid it out so cogently. She said one part, though, that was fast that I'm going to go back to. Be patient. I am going to work every day, so I'm one of those essential workers that has to be out. I am seeing more traffic on the highways now. Nothing has changed in California. There's not been a single adjustment into shelter at home and everything else, cover your costs, essential workers only. But I feel people loosening up a little bit. So I would tell, especially to, let's say, the AARP population, one of the number one risk factor, age. That's the one that we can't control. So I would say that be patient. Don't, I love my granddaughter. I'll just see her that one time. No. Keep up your guard. This virus is sneaky. It's called a novel coronavirus because it's novel. We haven't figured out how it is working. So I would say just be patient, keep up your guard, but in the end, actually exactly what Michelle said, this too shall pass.
Thank you, Dr. Brooks. Clarence, we started with you. I'm going to end with you with the final word. What final thoughts do you have for our listeners tonight?
Mike, Jean, thank you for having me. I'm going to amen what Michelle said. I was so inspired by what she said, and it really lifted my spirits. One of the things I'll say is one thing that is certain, that we're in an uncertain time. But you know what? We will, as Michelle indicated, we will get through this. Will we be the same? I don't ever think we will ever be the same. I am similar. I'm a hugger. I'm a person that walks up to people and greet them with a smile and a hug. And I've had to even change that approach with friends and distant relatives. I think that as we look to the future, we got to look at cities. We got to look at the local communities. And we have to work to get the resources and direct funding to our members, to our cities, because that's where the small businesses are. That's where the senior services are. That's where the mental health resources are. That's where the jobs are. And we have to make sure that people of color, looking at the data, get the resources they need to recover. Because if we don't get the resources and the health care that we need, this will continue to spread in our communities, and therefore it will continue to spread in other communities because we are working all over cities and towns and villages, no matter large or small. And I hope that we can continue to partner with AARP to get that message out because we are living in an uncertain time. But we will get through this, and I just pray strength and guidance for all of us as we go through this.
Thank you so much. This has been such an informative discussion for me, and I know for all of our listeners. I can't thank you all enough for your clear guidance, your wisdom, your hopeful words of patience and persistence as we gather together to fight our way through this tough time. So thank you again for spending your evening and late afternoon with us. And I want to thank all of you listeners, our AARP members, volunteers, for participating in this discussion. And again, if you like a call from a friendly voice, AARP's Community Connection has trained volunteers standing by. This is, again, a free service for all adults, regardless of membership, and we do, again, offer bilingual capabilities, including Spanish. Feel free to call us anytime at 888-281-0145 to be connected. Again, time to call us is Monday through Friday from 9 a.m. to 5 p.m. Eastern Time at 888-281-0145. And AARP is a nonprofit, nonpartisan membership organization, and we've been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus and prevent the spread to others while taking care of yourself. All the resources we referenced today, including a recording of today's Q&A event, can be found at aarp.org/coronavirus on April 24th. That's tomorrow. Again, that web address is aarp.org/coronavirus. We hope that you can go there, and if your question wasn't addressed today, you'll find the latest updates as well as other information created specifically for older adults and family caregivers. We hope you learned something that will keep you and your loved ones healthy. Be sure to tune back in with us next Thursday. Our next Teletown Hall is next Thursday at April 30th at 1 p.m. Eastern Time. Thank you so much for joining us. Have a good rest of the day. This concludes our call.